I'm Dr. Ravi, Chief Innovation Officer of EHA Clinics. In this role, I lead our research and laboratory teams. EHA Clinics is a JCI and ISO accredited healthcare organization in Nigeria that is transforming primary healthcare. And research and innovation are an integral part of what we do at EHA Clinics, so we can improve the wellness of our patients and our communities. So I want to invite you to come watch my colleagues and listen to them as they describe the different devices and process innovation we have in our clinics.
The Oxford Nanopore Minion Sequencer is a next-generation sequencing equipment model which uses the nanoparticles technology to sequence multiple samples in a single barcoded mix and run. The equipment is portable and can produce about 50 gigabytes of data from a single flow cell. The nanopore sequencing is the only sequencing technology that enables real-time sequencing and in also a full-scale format. With this equipment, we are able to produce sequence of genome of infectious agents and can determine the strains and variants of these agents in a single biological sample.
Telemedicine bridges the gap between the doctors and the patient. It's a non-physical online consultation whereby the patients can access doctors' care and consultations at their fingertips. This could be done via the phone or via the system. Our patients can book for these consultations via our website at any day and any time.
This is the high breast scanner. It is used for breast scan and it can be used to detect pathological abnormalities that are found in the breast. It can also be used to detect lumps in the breast without the use of sound waves.
The IQ Butterfly is a point-of-care ultrasound device that is used for point-of-care ultrasound testing at EHA clinics. It provides images of patients' abdominopelvic scans as well as obstetric scans. It can also be used to measure fetal heart rates.
This is the ECG SmartHeart device. It is used in EHA clinics. It provides a non-invasive and convenient measurement of the heart's electrical activity. Now, the advantage of this is that you can send the results via mail to any doctor in any location, and it can be used in collaboration with the telemedicine kits to aid diagnosis in any location.
This is the RxAll device. This device is used to measure the quality and the standard of drugs at EHA clinics. The drugs actually helps us to confirm that whatever drug we have is of top standard and of top quality, and it does this by measuring the active ingredients using a spectrophotometric method.
At EHA clinics, the near-infrared vein finder helps us to identify patients' vein without having to make several puncture attempts. The device poses no risk to the patient and also reduces turnaround time for phlebotomy.
Digital microscopy at EHA clinics helps us to transmit our images real-time from the microscope to the screen. This helps for reproducibility and accuracy during demonstration to our students or the medical laboratory scientists when we train.
This is a killer non-contact tonometer. It helps in the diagnosis for glaucoma. It's actually non-invasive in the sense that it doesn't have to come in contact with the patient's eye.
Alethea machine is a molecular-based platform that produces results in less than 1 hour. It works on the principle of loop-mediated isothermal amplification system. Because Alethea produces results in less than 1 hour, it helps us respond to AR requests and confirm malaria species for treatment.
ISO 15189:2012 is considered superior over other global standards. It focuses on general requirements for the competence of testing and calibration laboratories. And finally, it takes into consideration specific requirements for quality patient care.
Everybody in the society benefits from our research in one way or another. So for example, for patients, we try to find answers beyond the typical malaria and typhoid that you see in Nigeria, right? When you go to a clinic, you're sick, you're told you have malaria and typhoid. We know that's not the case, so we look for answers beyond that. Right now we are doing a study on a disease called dengue, which is spread by mosquitoes, just like malaria, but can make you sick with fever. Students and young scientists benefit from our research because we offer them paid internships, we offer them free webinars, we offer them several training opportunities. And then for companies and universities, they benefit from the research because they can trust us to do research at the highest ethical and scientific standards. EHA Clinics recently formed an ethics review board that is going to be registered with the Nigerian National Health Research Ethics Committee. So we hope you will join us as partners and collaborators to bring more research and innovation to Nigeria.
Okay, good evening, everybody. I guess our guests are still joining. Thank you very much, everybody, for joining us. This is EHA Clinics Lab Academy, and we're here again for another exciting time, another exciting learning experience on the topic Error Management and Root Cause Analysis, RCA, learning from mistakes to improve laboratory practice. I believe that this is a very timely topic. The reason is that one of the things you observe with growing organizations is process improvement. You're always trying to look for ways we can improve on what we have and not just maintaining status quo. And one of the positive parts to adopt in considering process improvement is learning from mistakes. So every mistake is not an opportunity to fire somebody, but it's an opportunity to learn. There might be a process gap. There might be a system gap. It may not necessarily mean that the staff is not probably well trained, but we don't just think people, we think systems. So one of the things that this webinar will help us straighten out is how we can improve our processes and check our systems, error-proof our systems, learn from errors, report incidents, and and then improve, evolve from what we see. Today we have a very respected senior medical laboratory scientist. For those of us who have been around a lot of programs, you'd see she's a major face. In fact, I call her Ma, even though my team have been calling her by her first name. The thing refused to come out directly from my mouth. So I read a little of her biography. Mrs. Oyebimpe Balogun heads the Quality Improvement Assurance Unit at the Institute of Human Virology. She coordinates the design and implementation of laboratory quality assurance programs at health facilities and project support by the Institute. She also oversees the provision of technical assistance to improve HIV rapid tests, HIV, TB, drug-resistant TB, and antimicrobial resistance, external quality assessment, and post-market validation and verification of test kits within the country. As program manager, laboratory quality assurance, she spearheads the Institute's drive to have more laboratories achieve national and international accreditations such as ISO 1590, ISO 17025, ISO 22870, ISO 17043, etc. She also manages the Resolve to Save Lives project to strengthen the quality management and specimen referral system of public health laboratories in the yellow fever/COVID-19 network. Mrs. Balogun develops and facilitates training programs to strengthen quality management systems, biosafety, biosecurity, among other areas. Her team also handles laboratory audits. She has served as program officer, laboratory, senior program officer, laboratory, and strengthening laboratory management towards accreditation master trainer within the Institute. She has also worked as a medical laboratory scientist in the University of Ilorin Teaching Hospital. Ms. Balogun earned her master's in public health from Imo State University, Owerri, and her associate membership in Medical Laboratory Science Council from the School of Medical Laboratory Science, University College Hospital, Ibadan. She also has certificates in conducting research responsibly and in leadership and in management in health from University of Washington, USA. Mrs. Balogun has several research publications to her credit and has participated in short courses and workshops. She is a fellow of the Institute of Biomedical Science, London, a member of the African Society of Blood Transfusion, and an African Society for Laboratory Medicine. She has also participated in national committees to develop and review laboratory guidelines. Her hobbies are reading, thinking, dancing, and she's married with children. An impressive resume, I must say, Ma, and we're glad to have you. Like you said yesterday, I don't know how I was able to drag you, but I'm glad.
I'm here.
Yes, ma'am.
Thank you very much, Obinna and Tim. I'm happy to be here. Anything that has to do with quality management system, you can be sure that you will find me there in terms of improving our laboratory space. Thank you.
Yes, ma'am. All right, so I guess so what's going to be happening is, you know, the usual rules, all right? So all our mics will be muted. We don't have the opportunity to speak until, although we're going to make it as engaging and interactive as possible. So I'll be monitoring that. So when she wants us to speak, I would allow that. And then most of the times we can use our chat box and the question and answer provision by Zoom. Aside that, we hope to have a very wonderful evening. And of course, at the end of the webinar, questions that may have arisen, we either drop it at the question section or we wait and see if how many of us will be given the opportunity to speak. All right, Ma. Let me hand over the stage and the microphone to you and do justice to your area of calling. Thank you.
Thank you very much, Obinna. I'm happy to be here. Like I said, can you confirm that you can see my screen?
Yes, we can see your screen.
Thank you. Good evening, everyone. I like an engaging session. It's not just going to be me on this side and just talking through. We're going to be going through this together as much as possible. So it's going to be very interactive, like Obinna has said, and as we progress, you're going to be seeing how you'll be involved in it. So we're looking at error management and root cause analysis. We want to see how we can learn from mistakes to improve our laboratory practice, okay? And this is our presentation outline. We're going to have a bit of introduction. We're going to look at what errors are. We're going to look at types of errors. We're going to see how we can identify errors. And then we're going to look at root cause analysis, which is the really main thing we're going to be doing this evening. And then we're going to see implementation strategy. So that's what we're going to be doing. Now for errors, we've had several of them, both reported and unreported. And you will agree with me that in this part of the world, we do not report errors enough. And that may really not be our fault. A lot of us have been trained in a way to see that error is negative. Yes, errors can have negative outcome, but it's not every error that is negative. We need to learn from our errors. Errors will always happen. So we're going to see this evening what we need to do with our errors, because we're going to have them. They're going to be here with us. As long as we're here, we're going to have errors. So in our space, we don't usually see most of these errors like in the public space. Quite a number of them are there, but not so many. However, you see in other